Okay, well, I'm Abby Bedeau. I'm a fourth year chief resident at UVA PM&R. And also on here tonight, we have my co-resident, Angela, who's also a chief. So we'll be tag teaming this PowerPoint. And then our program director, Dr. Jenkins, is also on with us. He's here to answer any questions people might have. He's going to be kind of monitoring the chat as we go. So during the presentation, if you have any questions, feel free to put them in the chat. And then I'm thinking we'll probably have a few minutes at the end if people want to like unmute and ask questions. So either way, feel free to just ask them as they come up in the chat or save them for the end. So with that, I'll get started. So again, we're University of Virginia, located in Charlottesville, Virginia. And so today, what we're going to talk about, a little bit about who we are in terms of like a residency program, our curriculum, research and didactics, the social events we have, and then where we're located and all the fun things to do in Charlottesville. There we go. Okay, so first starting off with who we are. So this is the most recent picture we have from Photo Day of all of our residents. So we are a 14 resident program. So we have two PGY1 residents. Um, who do their categorical training as interns with us. And then we also have two spots for advanced residents that will join us as PGY2s. So for PGY2 residents and then for each class as it goes. So just so you can kind of get familiar with us, these are our chief residents for this year. So you can see Angela, myself, and then Reed Collis and Joe Levinson. So if you end up interviewing with us, or if you're interested in getting more information about our program, any of us would be happy to chat with you. And we spend a lot of time together, like in and out of the hospital. I know it sounds like cheesy, but we really do. We got very close during our second year. We all sit next to each other, kind of worked as a team to help kind of with things that came up at the acute inpatient hospital. So I've really enjoyed working with our group during these last few years. And then a little bit about our faculty. So this is the most up to date. We currently have 19 attending physicians, a lot of sports medicine in our department, also electrodiagnostic medicine. So doing a lot of EMGs and neuroconduction studies in our program. And then, the whole span of SCI, TBI. We have a peds rehab attending who recently came on. And a lot of our attendings also did residency at UVA. So I think it's just a testament to, how much they really loved the program. And each resident gets paired with a faculty member of their choosing for one-on-one mentorship. And this has been a really nice addition into just kind of having more like formal and structured check-ins with someone who is in the field that you're interested in and kind of just making time for those career focused meetings along the way. Okay, so a little bit more about the key people in our department involved in the residency program. So our program director, as I mentioned, is on with us tonight, Dr. Jenkins. So he's been our program director at UVA for 15 years now. So quite a long time. He's really heavily invested in the program. He's attends pretty much all of our didactics. He's really interested in resident teaching. Basically, we work with him 3 months in PGY3 and 3 months in PGY4. He's an expert in EMGs, so we learn so much from him. And he's a lot of fun also, as you can see. And then the chair of the PM&R department at UVA is Dr. Wilder. His big thing is running medicine. So he actually has a textbook called Running Medicine. And we recently came out with a third edition, actually. And a lot of the residents got to help myself and Angela included write chapters in it. So that was a really cool project. He is all over the Charlottesville community. It's a big running community. So our department actually covers a ton of local road races. And this is Dr. Wilder and I at one of those races. So we get to provide a lot of medical coverage from the high school level to the collegiate level to community road races. During my second year, we actually covered the NCAA cross country national championships that were hosted in Charlottesville. So that was a really cool opportunity to cover a very high level event. Um, and you work with him 3 months during your third year on your musculoskeletal rotation. I'm sorry. I have a 12-week-old puppy at home and he's biting my foot right now. So, okay, hopefully he settles down. Good boy. All right. And then our program coordinator, this is Elena Alba. She replaced someone a couple years ago who I thought there couldn't be anyone better than her, but Elena is definitely right up there. She is so on top of everything. She keeps track of all our rotations, didactics, vacations, evaluations, everything. Like I wanted to do an away rotation during my third year, and there was a lot of logistical challenges, a lot of paperwork, and she helped me through all that. And it was a very tight time frame too, and we managed to get it done. So she's awesome and very crucial to have a good program coordinator in your residency. And then a little bit about our alumni. So kind of, where do most of our graduates go? So, I mean, they go anywhere, of course, but I tried to focus in on the most popular things. So I'd say the three biggest fellowships would be sports medicine, interventional spine, and then pain. And then in terms of people who go straight into a career and say kind of like general physiatry in an academic setting, electrodiagnostics, as I mentioned, our program is pretty heavily focused on EMGs, outpatient musculoskeletal medicine, and then just kind of general private practice as well. And this is Dash Duncan. He just started his sports medicine fellowship. He matched to UVA, so we're excited to have him around for another year. Okay, just seeing how I'm doing on time. All right. I think Angela is going to take over from here. I can advance slides for you, Angela.
Oh, even better. Perfect. Okay. So taking over from here, I'm going to talk a little bit about our curriculum next. So, first year, as Abby mentioned before, we have two residents that come as interns, and they do their first year as categoricals at UVA. So the breakdown of that is shown here, and I won't go through it in very great detail. But the breakdown, as you can see, is pretty heavy in general inpatient medicine, but then really good experiences, especially in neurology, and then some of the outpatient rotations as well. Just as an example of two different experiences, Abby is one resident who did the categorical curriculum here. So she did her intern year here, and I did mine elsewhere. And then we convened for PGY 2 year.
Yeah, and then just one thing I'll mention, since I did my I did my intern year at UVA, it's a really nice balance between inpatient and outpatient because you get on your outpatient time, you don't have to work any weekends. So there's a good majority of the year that you're not working weekends. So it's kind of a nice perk. And you also get a month of PM&R, which is really good as well.
All right, and then into the PGY 2 year curriculum. So this year is mostly spent at the inpatient rehab hospital and is broken down into rotations such as neuro rehab, spinal cord injury, and orthopedic or joint rehabilitation. And then there's also general inpatient rehab as well. So essentially 4 different teams or services, and we rotate through each of those typically every 6 weeks. And then there is included in this year a total of 1 month of inpatient consults over at UVA's main hospital. Those are usually broken down into two-week segments. And then also a really nice part of the PGY2 curriculum is a 1 week elective. So we have a wide variety of things such as outpatient clinics or whatever it is that we might be interested in, and our wonderful program coordinator, Elena, can help get us set up with a great schedule for that week. And it's a nice, not only kind of a break from the inpatient schedule if you want to go try an outpatient rotation, but it's also a nice way to early on get a feel for if you're interested in something like pain medicine or sports. You can get some time in that as a second year. All right, and so here's where we do most of our second year at the UVA Encompass Health Rehabilitation Hospital. So here's some photos of the team here. You can see me and Abby down there in the bottom left corner in our nice side-by-side desks where we spent our whole second years. And then you can see some pictures here, just including some of the physical and occupational and speech therapists as well. We get really close with them throughout the year. They're really wonderful to work with, and they're honestly one of the best parts about being at the rehab hospital. It's just so easy to watch our patients during therapy or discuss our patients with the therapist because they're just great to work with. And a note down at the bottom of that slide as well is that the rehab hospital will be expanding from 50 beds to 60 as well. So that's a construction project that's under way right now with exciting expansion in the future. Okay, so onto the call schedule. Shout out to Abby for making this amazing color-coded call schedule. I'll break it down kind of as it's listed on the left. So our call schedule is obviously for the inpatient rehab hospital, and we take home call. So generally during the week, it's starting at 5 p.m. and then goes till 8 a.m. the next morning. We can be at home and take pages and answer calls from there, and we can typically address most of those calls without leaving home. Just log in remotely and put in orders. Sometimes you have to go in if there's an emergency or a patient that you really need to evaluate in person. But most of the time, it's something that we can address from home. And then there's no post-call days. So if you're on call, for example, on a Wednesday night into Thursday, you do come in the next day on Thursday. But obviously, everyone's really supportive. And sometimes, for example, like if Abby had a rough call night, some of the other residents, myself or Reed or Joe, might help her with an admission or something if she's busy the next day and she's feeling tired. So everyone's really supportive, which is great. And then an important point is the call is front loaded. So you take most of it as a second year resident, and then that kind of dwindles as you go into third year and fourth year. So by the time you're a fourth year resident, you have the least call that you've had in all 3 or 4 years here. And then there's also a backup resident on call, and that resident is able to help with admissions on weekends. And then an important point that Abby included there as well is that it's easy to swap. So there's a lot of flexibility in our call schedule. Residents obviously have things in their own personal lives that they'd like to make it to. And so swapping with residents is a very easy thing to do. And then you just see in the center of the screen the breakdown of an example of a month of call. All right, so PGY3 curriculum. This year is a really exciting year. I think it's just a chance to have 3 months at a time, really digging into things like sports or EMG. And it was a really enjoyable year, I think, for Abby and I both. You can see the breakdown here is 3 months of kind of a sports and musculoskeletal outpatient rotation, including some cool parts like prosthetics and orthotics and a little bit of rheumatology. And then we spend 3 months as a third year resident doing electrodiagnostic medicine, so rotating with Dr. Jenkins and one of our other EMG attendings, Dr. Warwick. The nice thing about that is we're always paired with a fourth year resident, so you kind of get a senior resident as well as an attending to help guide you as you're learning these EMGs because they can be pretty complicated. An important point to note about this is that because we have such a robust electrodiagnostic clinic, mostly under Dr. Jenkins, we get like hundreds above the minimum requirement of how many EMGs that we need to do. So we have a lot of opportunity to just really get the repetition and see some neat cases on that rotation. So it's a true strength of our program, and every resident comes out of our program having done well over the minimum requirement. Probably, you know, I would guess some of the most EMGs in the country, I think, as Dr. Jenkins just said in the chat. I didn't want to make any statements that might be false, but he knows the true stats. And then I want to keep an eye on time here. So you can see the breakdown of the rest of the year. It's a variety of outpatient and pain management, and then some covering consults for the second year as well. And then you do get one elective as a third year, and I'll get to more of the electives in fourth year as well.
Yeah, just to let you know, the 5 minutes.
Thank you. Yep. So PGY4 curriculum this year is just heavy in electives, which is awesome. So a lot of opportunity to tailor your schedule to yourself and your interests, and then more EMGs, as I mentioned. And then we do some peds, occupational medicine, and interventional spine as well. So the fourth year is also a really great year, lots of opportunity in the outpatient clinics with a broad variety of attendings. Okay, vacation, important topic for sure. So we get 3 weeks off each academic year, and we have one designated week at the holidays, either the week of Christmas or the week of New Year's. And then there's additional days that are allotted for, interviews, conference attendance, that type of thing. So we do feel like we have a good balance of work hours and then also time off as well. All right, so a bit on research and didactics. So half-day didactics are a newer development in our program. It's something that I think is a really great example to share because we used to have pretty exclusively noon-hour didactics, and us residents, we felt that we would learn better with a half-day didactic session. And so our attendings and our program director kind of heard our request and they made it happen. So we've been really grateful for that. And I think residents have felt that it's been really helpful for their learning. And then we also have noon hour didactics for things such as board review and running medicine conference. And then lastly, journal club is a really nice, not only opportunity to discuss articles, but also sort of a social event too. We do them at local restaurants, or our attendings will have us over at their houses. So it's a really nice way to chat about an article, but then also just have some time together to socialize. All right, we do have throughout the year ultrasound curriculum that our attending Dr. Rivniak puts on. He is kind of the ultrasound and ultrasound guided procedure guru. So we're really lucky that he sets aside time to work with us and, as you can see in the photo, give us hands-on opportunities with the ultrasound. We practice on each other. He has a set curriculum that he works throughout the year, and this is protected time where we don't need to be in clinic and we're allowed to be there in person learning. And then Dr. Grice, one of our other attendings, he puts on an interventional spine course. He does this throughout the year. He does the lumbar spine in the fall and then C-spine in the spring. He takes this time out of his own busy schedule and gives us a series of lectures. And then we get time in the cadaver lab to practice what we learned. So it's a really great opportunity for anyone, but especially for those who are interested in going to pain management. And then sports coverage, a definite strength of our program. We do a lot of running events, and then we also do high school football and a number of other events. But I would say running is kind of the most popular one for what we cover. Abby and I are both runners ourselves, so we've gotten out there and had a ton of great opportunities, as you can see in some of the pictures here. And anyone is welcome. And then we have a couple big events where we have kind of all hands on deck. And then research and conferences. We have also shared with our attendings that we would like to be able to attend, more conferences, and they've made recent adjustments to funding, and we feel very very privileged, I would say, to be able to go to the conferences that we get to go to and to have the support from our program. You can see a number of photos here from recent conferences. I would say PM&R and AAP are the most commonly attended, but there's definitely residents who go to electrodiagnostic conferences and pain management conferences, as well as some of the sports ones as well. And we do get excellent benefits as well for learning resources such as question banks. Every resident gets a copy of Cucurullo's PM&R board review book. And then we also get a musculoskeletal physical exam book as well. So I feel like our learning is very well supported. And then we have extra funding available for specific things that we might want to spend it on, such as board exams or other textbooks that we might be interested in.
Yeah, and I know we're pretty much right at the end of our time here. So We do have more on like social events and things to do in Charlottesville, but we're just gonna have to keep you in suspense. So you'll have to come interview with us to see the rest of this. But yeah, you can also look it up. But I'm just kind of gonna skip to the end. There's a ton of fun things to do in Charlottesville. But I just wanted to point you guys to YouTube. If you Google UVA PM&R, we made this virtual tour last year, so you can get a closer look into like our clinic facilities and kind of day-to-day life as a resident at UVA. So please check that out and also take a look at our Instagram page. We put up a ton of different reels and posts, just like I said, a great way to get a little bit more insight onto what it's like to be a resident here. So thank you so much for having us, and feel free to reach out with any questions.
Thank y'all.